So we're coming in on some of the warmer, more, rainy parts of the year, and then into the summer. We're going to see an influx of those people as they're coming out of school and people who are really getting into their annual exams. And what we really want to emphasize is heartworm prevention. A lot of talk about it, tons of products out there. Why do we use it and why do we test for it? Really easy, 10-minute test in-house, a few drops of blood, and it lets us know whether they're antibodies to the heartworm. Now, the important thing about the test, it's antibodies to an adult female heartworm. And it takes 6 months for a heartworm to mature up to the adult stage. So there is kind of a gray zone where you can't always predict whether a dog's heartworm positive or not. And that's why we like to stay on heartworm prevention year round, because even if you miss 2 months, there's a chance that if your dog gets bit by a mosquito, they're infected with the baby worms, and that'll get to what the products do here in a second. After a couple months, they go to the 4th and 5th stages. There's no test for that, and the heartworm prevention doesn't tend to work on those very well. And then we have to wait a full 5 or 6 months before we can test for the adult. So that's one of the reasons we recommend testing every year. Another is we are getting some resistant heartworm populations, especially in kind of that Mississippi River Delta, Louisiana, Mississippi area, Houston, Beaumont, and even moving up from the coast. One of the statistics we'll even see is that if you are near the coast or near the outlet to the Mississippi River and your dog's off heartworm prevention for 5 years, they almost have a 100% chance of being heartworm positive. So we test for it every year. We make sure we don't see any of those adult worm antibodies in the bloodstream. If it comes up positive, we look at a drop of blood under the microscope. We look for a baby worm, microfilaria, we'll call them. And if that's the case, then we really need to look into if a dog's positive, how do we treat them? But let's not get there, people. Let's just stay on heartworm prevention year-round. Here in Central Texas, it needs to be year-round. Mosquitoes never die off for the entire winter. And what we like is to get you on a monthly or a year-long injection. So for the products I carry here, there's lots of products out there. HeartGuard Plus, been around a long time. It does have a deworming in it that helps deworm dogs once a month for hookworms, roundworms. Very well tolerated, very palatable. Most dogs like to eat this. And you can get a 12-month box, usually for under $100, pretty inexpensive. If you go up a step and you're worried about fleas and ticks, but you're worried about not having to give 2 different medications, the makers of HeartGuard are now making NexGuard Plus. This one will get fleas and ticks. It'll do heartworm prevention, and it'll do plenty of small intestinal parasite control as well. Another added benefit, even though they don't have a complete label, is this has efficacy against certain manges, demodectic sarcoptic mange. So we like this as an all-in-one. And again, lots of products out there, all pretty good. Manufacturer I stick with, HeartGuard, NexGuard Plus. There is one other option. If you're a little bit scatterbrained, you can't remember that once a month, your Google Calendar doesn't work, you can do the ProHeart 12. The ProHeart 12 is a once yearly injection in heartworm negative dogs that constantly releases slowly from a depot under the skin, so that your dog, instead of being dewormed or killing off baby heartworms once a month, is actually got constant level protection. It's a good injection. It is price comparable to the HeartGuard and NexGuard, probably right in between the two, price-wise on those products. Does not get external parasites, fleas or ticks. Does get hookworms. There are a very small percentage of dogs that can have an allergic reaction to this. We don't see it very often, but it's something to know about before you decide which product is best for you. Bottom line is, test for heartworm disease at least once a year. Make sure you're not getting any resistant populations in your area. Stay on heartworm prevention once a month. Pick which product you prefer. I tend to like these products the best. And if your dog is heartworm positive, remember, the only way to really kill off heartworms successfully is an injection called imidacide, which is an arsenical solution that has to be given in the muscle, and it has to be injected a couple of different times. We do a protocol here where they get 3 injections. Dogs can have allergic reactions to that injection. They can have pain. They have to be rested while the worms are dying so they don't throw a clot into the lungs. And that rest can be a good 4 to 6 month ordeal on the owners and the dog. And I will tell you, a one-time treatment for heartworm, you could almost pay for an entire 10 to 12 years of heartworm prevention for your dog, depending on which product you pick. So economically, financially, medically, physically, the best thing to do is just stay on that Heartworm